Should we get started or are we waiting? Should we wait a few more minutes? Oh, can everybody hear me? Can everybody hear me? Oh, okay. So
Testing 1 2. Okay. Yeah. Turn me. Yeah. It sounds. It's getting better. Jordan. Testing 1 2.
I can hear you guys now.
Okay. Testing 1 2. Okay. Yeah. Turn me. Yeah. It sounds. It's getting better. Jordan. Testing 1 2.
I can hear you guys now.
Okay. Testing 1 2. Okay. Yeah. Turn me. Yeah. It sounds. It's getting better. Jordan. Testing 1 2.
I can hear you guys now.
Okay. Testing 1 2. Okay. Yeah. Turn me. Yeah. It sounds. It's getting better. Jordan. Testing 1 2.
I can hear you guys now.
Okay.
Ready to go? I'm ready when you are. Good afternoon, church, and everyone on Zoom and Facebook. Today I'm welcoming you to our monthly seminar on pancreatic cancer. My name is Dr. Christine Mills. And today, pancreatic cancer. Our speaker will be Dr. Pratibha Vemampally, and she's one of the, sorry about that. She's currently our Director of Surgery at Brooklyn Hospital. She's a board-certified general surgeon. Dr. Vemampally previously served as Director of Bariatric Surgery at Montefiore Medical Center and Director of Preoperative Services also at Montefiore Medical Center in the Bronx. But she's currently here with us at Brooklyn Hospital. She's a graduate of the Jefferson Medical College and also of Albert Einstein School of Medicine. Our health seminar today is on pancreatic cancer, which is the third leading cause of death in the United States. But before we start our seminar, let's open with a word of prayer. Father, bless this health seminar today and let your presence be felt among us. Help us to place the care of the people at the forefront of our agenda today. Lord, we pray that you would deepen our compassion and broaden our thinking and understanding of our topic today. Lord, bless our speaker and make sure each and every one of us enjoy and learn something today. I ask all this in Jesus' name, amen. Dr. Pratt, you can take over.
Perfect. I think there's a little bit of an echo, so everybody bear with me. I will try to make this brief. Can everybody hear me? Okay.
Yes.
Okay. So we are talking about pancreatic cancer. And, pancreatic cancer is a very tough cancer in that it's often discovered at late stages, right? Like all cancers, if we find them early, we can treat them and patients do very, very well. So if you have a stage 1 cancer, even if it's pancreatic cancer and we find it, then we have a lot of options. We have a lot of treatment options and patients do well. The problem with pancreatic cancer is we often don't find it until later. And I'm just trying, there we go. Sorry. So one of the reasons I want to just go over why pancreatic cancer is considered such a bad cancer. It's considered a really bad cancer because we find it when it's already spread. And the reason for that, and I just want to go over the pancreas a little bit so that we're all on a similar page. So this is a diagram first of the abdomen, right? All over here. And you can see here's the colon, here's the stomach. The pancreas lives behind the colon, behind the stomach, way in the back. So the pancreas is really the last structure in your belly. And it is in your belly. But because it's so low down, there's so much space and so many things on top of it. And there's so much space that it can grow into. And because there's so much space that it can grow into, we often don't see we don't feel, right? When we have a cancer, many times, we'll go and get tested because we don't feel good or something's wrong. And with pancreatic cancer, because it lives so far down in your belly and it's not really immediately surrounded by a lot of stuff, it's really the lowest thing in your abdomen that it grows and you don't often feel it. Okay. And that's the important thing to remember about pancreatic cancer. And we are going to go into some symptoms later on. But one of the problems with pancreatic cancer is we don't feel it till it has gotten big and or spread to other organs. And the other problem with pancreatic cancer is there's no easy test for it. And when I say easy test, for colon cancer, there's bleeding, right? We can screen for colon cancer because we can get to the colon pretty easily. With pancreatic cancer, again, with the pancreas, because it lives so far down, we can't get to the pancreas easily to say, hey, is there a slight problem? Is there a way we can test for this? And a lot of that is because of what the organ does and where the organ lives. Now, in the middle here, right, you see a diagram of the pancreas. And pancreatic cancer often grows into this duct, right? This is that duct in the pancreas. And we'll go over the pancreas and what it does in a little bit. But because this duct is so long and the cancer can grow anywhere here, that's one of the reasons that people don't feel pancreatic cancer, because you're not going to feel it or you're not going to have symptoms. Sorry about that. I'm not really, just kind of advancing here. Let me try that. There we go. You won't see it until this main duct is clogged, and it takes time for that duct to get clogged. And the cancer often spreads or gets big before that happens. Okay. And so that's kind of the 411 about pancreatic cancer. Again, like any cancer, like all cancers, if we find the cancer early, you're always going to do better. And that's why we're going to go in a little bit to symptoms of pancreatic cancer and or, who should be looking out for it and where you should go if you want to get tested for it. The next piece of this, I just want everyone to kind of understand what the pancreas does, right? So what does the pancreas do? The pancreas is an organ that has two functions. One, it secretes enzymes, and it's the enzyme portion that affects that the cancer comes from, right? The enzymes that the pancreas secretes goes into your small intestine, right? Almost right after food leaves your stomach. That first portion of small intestine is where the pancreas, just to go back here, right? This is the first section of the small intestine, right? Your stomach is here. The pancreas has this main duct, and it makes these enzymes, and the enzymes get dumped into your small intestine right here, very close to your gallbladder. And right here, see that? You can see a couple drops of enzymes. And those enzymes are critically important when you eat. When you eat, your food needs to be digested. And it's all one of the things that helps digest it is these enzymes from the pancreas. Those enzymes digest food so that the rest of your body can absorb the food. Okay, so that's one of the things the pancreas does. There's a second thing that the pancreas does, and it secretes things that we call hormones, hormones like insulin. So the pancreas is critically important in regulating or keeping us from being diabetic, right? When our insulin levels are appropriate and we're not diabetic, that's because the pancreas is working. So those are the two things that the pancreas does. And what we call it is the endocrine function of the pancreas, endocrine meaning the hormones, and the exocrine function of the pancreas, meaning those enzymes that help absorb nutrients and break down food so that your small intestine can absorb it. So that's what that organ does. What diseases can happen with the pancreas? Well, there can be problems with the functioning of those organs, right? Of those hormones, and the functioning of those hormones obviously gives us something like diabetes. It can give us other more rare hormone issues, but diabetes is the most common. And I'm sure everybody in this audience knows somebody who's diabetic. And that's because the pancreas, right, specifically the beta cells in the pancreas secrete insulin. You and I all have a certain amount of insulin in our bodies. And what I always joke with people is it's kind of like the oil on the planet Earth, right? There's only so much oil on the planet Earth. When it's done, it's done. And for all of our bodies, insulin is the same thing. So the pancreas is critically important in making insulin and releasing insulin on demand. So that's one of the things the pancreas does. When it doesn't work, you get diabetes. Other things that can happen in the pancreas, it can get inflamed, right? Those hormones that the pancreas secretes to break down food, well, those are toxic hormones because they do such a great job breaking down food. And when they're inside your small intestine, they don't do any harm. But if they somehow leak out into the pancreas, it can cause an inflammation of the pancreas. And we call that inflammation pancreatitis. And many of you may have heard of pancreatitis. Pancreatitis can happen if you have too much fatty food. It can happen if you drink too much alcohol. That's usually a very common cause of pancreatitis. But it can just happen because it happens, right? And when that happens, we usually have to rest your pancreas, give your body some time to recover and heal. Other things that can cause pancreatitis, or inflammation of that hormones, or basically getting those hormones where they shouldn't be, is gallstones. Gallstones can cause a backup in that main duct in your pancreas, and you can get an inflammation from gallstones called gallstone pancreatitis. Another thing that can happen in the pancreas is cysts, right? Cysts can form in the pancreas just like they form in other parts of our body. Sometimes those cysts are not a big deal, and sometimes they're a big deal. And the only way that we can determine that is to kind of investigate those cysts a little bit. And that's a common, kind of lecture point itself. So, I won't get too much into that, but those are kind of what we call the benign diseases of the pancreas, the non-cancer causing diseases of the pancreas. Of course, there's cancer forming diseases of the pancreas too. All of the cancer forming diseases start again on that main duct that travels all along the pancreas, right? And those little ducts that go into the pancreas, and that's called pancreatic adenocarcinoma. When does pancreatic adenocarcinoma happen? It usually happens in people that are that are older, right? 60, 65. It's very, very uncommon to happen before that. Usually there's a family history. If somebody in your family has had pancreatic cancer, you're at a higher risk for having pancreatic cancer. Pancreatic cancer is also associated with something called BRCA, right? That breast cancer gene. If you have that breast cancer gene in your family, you have a slightly higher chance of having pancreatic cancer. If you drink alcohol and you get a lot of pancreatitis, you are at a higher chance of having pancreatic cancer. And the symptoms, and we're going to go into the symptoms in a little bit, but one of the big symptoms of pancreatic cancer is actually pain. Okay, and we will go into some of the other ones in a minute. But that's cancer in a nutshell. So you can see here, right, this is a diagram of a tumor or cancer growing in the pancreas. And what happens is, again, I don't know if you remember from that first diagram, there's that main duct that goes this way. And the cancer basically sits on that main duct and clogs that main duct. And that's how we know, or that's how we have symptoms of pancreatic cancer. Now, again, if we find pancreatic cancer real early, we can just cut the cancer out. If it's way over here, right, we can just cut that piece out and it becomes real easy to do. If the cancer's over here, like it is in this diagram, that becomes a much bigger and larger operation to treat. And you can still treat it with an operation as long as first, we always make sure that the cancer hasn't gone anywhere else over here or into the nodes. If that happens, if the cancer spread, right, if it's not confined to the pancreas, then we have to give you chemotherapy first. And we have to see if we can treat all those other areas. And then lastly, we go in and get the cancer here itself. And when we take the cancer out of the head of the pancreas, right, it's either in what we call the tail, which is easy to deal with, or the head. If it's in the head, we have to kind of cut all this stuff here out. And that's why it becomes a larger operation, because we have to cut out the pancreas, we have to cut out a portion of your intestines, and many times we have to take out your gallbladder. Or if it's pushing on that main gallbladder duct, we may have to take out a portion of that main gallbladder duct. And what makes pancreatic cancer so complicated to deal with is if it is big, is that it's not just the pancreas we have to deal with. We have to deal with all of the structures around the pancreas, because if you can imagine, the pancreas is kind of like a sticky organ and it's attached to all these things. So we have to often take the things that it's attached to with us and reconstruct a whole bunch of different things. And that's what makes pancreatic cancer difficult or harder to deal with. But for the purposes of this talk, I really want everyone who's listening to really think about the risk factors, right? To think about, okay, what can I do if I think I have this? Or how can I determine if I'm at a higher risk for having this? So here are some risk factors of pancreatic cancer, and I'm happy to share this with Christine, and she can send it out if anybody's interested. But here's some of the risk factors of pancreatic cancer. Again, we talked about smoking, right? Smoking is often a risk factor for a lot of cancers. And that's because what smoking does is, right? So our cells are dividing every day. Our cells are creating new cells every day. And every time our body creates new cells, it's not always perfect, right? Sometimes you get a mistake. I always think of it as like a car factory, like in a car factory where you're making cars. And if one piece is screwed up, you need somebody to kind of come over here and onto the assembly line and say, hey, that piece is screwed up. Don't let this car through. When we're younger, there are mechanisms in our body to say, hey, that piece is screwed up. That cell's screwed up. It's screwed up. Let's take it off the line. As we get older, it's harder for our bodies to do that. And that's why age is a factor with cancer. Smoking decreases your body's ability to say, hey, that's screwed up over there. That cell is screwed up. Let's get rid of that cell. So smoking is a risk factor for pancreatic cancer. Smoking is also a risk factor for a lot of other cancers. For the pancreas, diabetes is a risk factor, specifically because diabetes, again, I want you to think of it, it comes from the pancreas. Inflammation, because anytime something gets inflamed all the time, and specifically pancreatic inflammation, if it's happening over and over, more than four times a year, then you've got a lot of infection or a lot of inflammation in that area, which can predispose to cancer and or make it harder to diagnose cancer because there's already something going on there. There's family history that we talked a little bit about. Obviously, family history of pancreatic cancer is the most alarming, meaning if somebody in your family has pancreatic cancer, you are definitely somebody who should be screened for pancreatic cancer, somebody who we should look at and say, hey, what is the risk factor of that person having pancreatic cancer? Beyond that, it's other cancers. And I have some over here now. We talked about BRCA, the breast cancer gene. If you have that, then by all means, you're at a higher risk for pancreatic cancer. The other ones are things like Lynch syndrome. Lynch syndrome is something that is associated with colorectal cancer. If you have that, if you have melanoma syndrome, right? So these are all syndromes that are part of the cancer family. And hopefully you'll invite me back and we can talk about Lynch syndrome and some of these other things in more detail. But if you have a family member who has any of these syndromic cancers, right? Basically what that's saying is you've got a gene in there that's not so good at picking up those cars that are manufactured incorrectly. You're at a higher risk. Obesity puts us at a higher risk for pancreatic cancer, as it does for many other cancers. So obesity is a general risk. And again, we talked about age. So if you fall into any of these categories, I would say you're somebody who probably should be screened. And we don't screen everybody in these categories, but certainly if you have some of the symptoms of pancreatic cancer, we should screen you. Now, what are the symptoms? Again, remember what I said, the pancreas lives way down deep. And since it's down deep, we don't often see the problems with the pancreas as often, or it's harder to pick up. But here's some symptoms. The first one is pain. And most pancreatic cancers first show up as pain. And it's usually pain in your belly, pain that radiates to your back, because those are where the nerves of the pancreas are. Loss of appetite, right? Or weight loss. When you get what we call jaundice, right? Babies have it when they're the whites of their eyes get a little yellow. Sometimes skin gets a little yellow, most commonly in white people. People with my complexion, it's a little harder to tell that your skin is getting yellow. But what can happen is it can start to itch, because that stuff that makes your skin yellow, bilirubin, that makes our sclera yellow, tends to make you itch, right? It's called jaundice. So that's a risk factor. If your stools are light colored, that's a risk, because again, remember when I said the pancreas makes enzymes that help you digest food? So when your stools are light colored, it means that there's a lot of fat in them and the fat's not getting absorbed. If your urine is dark, that's from that bilirubin. And the itchy skin, again, from that bilirubin. So that's signs of pancreatic cancer. Subtle signs, blood clots. Because oftentimes when you have a cancer, you can clot more, and fatigue, because sometimes your hemoglobin counts are not as high. So again, a lot of non-specific symptoms. This is why pancreatic cancer is hard to detect. What I would say is the two most common symptoms, or the three, I should say, belly pain, right? If you're having pain that's just persistent in your belly, get it checked out. If you're having yellow, right? Yellow in your eyes or itchy skin, get that checked out. Doesn't happen all the time with pancreatic cancer, but that's usually something we need to get checked out no matter what it's coming from. Or a change in your stool. So if your stool goes from a normal color within 6 months to a light color, that should get checked out too. Okay, and I think those are the three big symptoms or signs to really get checked out for pancreatic cancer. So how do you get checked out, right? And this is the other reason why pancreatic cancer is hard to detect, because there's no easy test to detect it. The most common test that can really find something wrong is a CAT scan. So to find the pancreatic cancer, you would need a CAT scan, right? And to do that, you can obviously see your general practitioner, your family doc. You can see a gastroenterologist. You can even see a surgeon like me, because we're all, qualified to order that CAT scan, take your symptoms seriously, and look into it. But really, at the end of the day, to get tested for pancreatic cancer, it really does take a CAT scan. And with that, I'm going to stop. I know it's pretty much a general discussion of pancreatic cancer. And it's a tough topic because it is a complicated disease. But I'd love to answer any questions you guys might have. It might be easier to put your questions in the chat. And I'm going to stop screen sharing so I can see the chat. Oh, here's the chat. Never mind. Okay, so I can see the chat. Does anybody have any questions? Oh, yep. Nona? I see a hand up. I don't know if that's, oh, you're going to have to unmute or put yourself in the chat.
Mistake.
Oh, okay. Does anybody know anybody who's had pancreatic cancer that's listening to this? A family member?
Yeah, my goddaughter died from pancreatic cancer, and she was in her 30 years old, and I have a family member that died from it also. And my question to you, if you have cancer, you should get your doctors to do what you call it, because I had
CAT
bone
scan.
cancer, and I'm doing good so far, but my doctor never requests for me to do what you call it there.
So honey, I think, a CAT scan is non-specific, but it's really the only way to diagnose it. I think adding symptoms to a CAT scan is the most effective way. So what I would say is be on the lookout for change in your stool, for weight loss, pain. And if you should have any of those things, go to your doctor right away to get a CAT scan.
Yeah, what she does, like every 6 months, she do a complete exam.
Good. Perfect. Cancer does happen sometimes in young people, like your 30-year-old goddaughter, but it's actually pretty rare with pancreatic cancer. It usually happens at 60. What that means is, the gene that causes the cancer is there. So you definitely, I think you're doing the right thing and you should be vigilant. I think your doctor's doing a great job if she's getting you in there every 6 months. Any other questions? So I'm hoping Christine is going to invite us back so we can do colorectal cancer, because I think colorectal cancer, especially in an African-American population, is really important to talk about. And there's so much we can do for colon cancer, especially if we can find it earlier. And unlike pancreatic cancer, where it's really hard to detect, colon cancer can be detected much easier. There's some great tests out there that you can even do at home versus coming to see a doctor. And we can really diagnose it early. And if you diagnose it early, you can cure the cancer. And that's a term that we rarely use in medicine, cure cancer, but we can absolutely do colon cancer.
Thank you, doctor. I do have a question.
Yes.
Upon your presentation, I understand that we should not be drinking, we should not be smoking, but what do you suggest as preventing action naturally we should be doing to prevent the pancreatic cancer from developing in our body?
So I think anything you can do to make your body healthier, right? And the things are not smoking, drinking in moderation for sure, right? Not getting pancreatitis. And the third thing is really tackling obesity. Fourth, if you have a family history, being very aggressive about talking to your medical professionals and saying, hey, I have this family history, and making them aware.
Hello?
Yes.
Yeah, hello. This is Miss Stewart again. I have a family member that was diagnosed with cancer and they never smoke and they never drink.
I think that obviously that does happen, right? There are all kinds of reasons why we get cancer. There is no one silver bullet, but the things to do to decrease each one of us as individuals getting cancer, I think, is to make our bodies as healthy as possible. And I think that's where not smoking and really limiting drinking really comes into play. You're absolutely right. There are people who do all the right things. They exercise every day. They're skinny. They don't smoke. They don't drink, and even at age 30 or age 40, they get cancer. And it's tragic, and there's very little that we can do for that. But for the majority of people, if we live a better lifestyle, right? Like I said, think of cancer as, our cells are dividing every day, and we have millions of cells in our body dividing every day and producing new cells. Each one of those new cells could be a cancer if our DNA doesn't transfer appropriately. But it's not. And it's not because our bodies are so good, just like that car factory, when there's a defective cell, pulling it off the line and not letting it go through. What we want to do is we want to help our bodies pull those defective cars, those defective cells off the production line. And the ways to do that is to exercise, to give your body every opportunity to limit obesity, to treat our medical problems, and really let your body function at its best. I hope that makes sense, everybody.
Dr. Pratt,
Yes,
what about the patients who are asymptomatic, especially in females, who get diagnosed with pancreatic cancer only because they did a pap smear, and other than that, they had no other symptoms? Can you speak on that?
So
Asymptomatic patients?
Usually I think it's a pap smear, and then they get a CAT scan trying to stage something, and then the pancreatic cancer is found secondarily, right? The problem with pancreatic cancer, and it goes back to that first slide. Let me try to go back here. The problem with pancreatic cancer is always that. Look where the pancreas lives in this diagram. The pancreas lives all the way next to your spine. So when something happens in the pancreas, there's a lot of space there. In the breast, if you have a breast tumor that grows, you're more likely to see it. And when you see it, you can go to the doctor and get it treated. And that's what allows us to detect breast cancers at lower stages. Stages mean how big is the tumor and how big and where has the tumor spread. With the pancreas, the problem is that it lives so deep down, way down by your spine. And because it's so deep down, it has all this space to grow in before it causes a problem. And that's often why pancreatic cancers are found at a very high stage. And a high stage means a big tumor that's spread.
Thank you.
Any other questions?
I have one more. Hold on.
Yeah.
Yeah, doctor, is it possible for a person to get a complete DNA to tell whether their cells are cancerous or not?
So not so much. What there are is DNA markers. And that's the Lynch syndrome marker, which is an actual marker. It's BRCA, right? The breast cancer marker. Those are actual markers. And what those markers are they're basically telling doctors or scientists or, however whoever, that there is a DNA repair mechanism that isn't working as well as it should. And I go back to, and I hope this makes sense, the car factory, right? Those DNA repair mechanisms are the mechanisms that are supposed to say to your body, that cell is not made correctly. We need to destroy it. That cell is not made correctly. We need to destroy it. And when those mechanisms aren't there, that's where cancer multiplies most easily. So although there isn't anything for pancreatic cancer per se, right? There are protein markers that can say, hey, when you have pancreatic cancer that we can follow it with. But there's no DNA marker that says whether you have cancer per se or not. The only way we know that you have cancer is we actually have to test the individual cells to say whether you have cancer or not. But there are tests where you can do a BRCA test to see if you are more predisposed to breast cancer and pancreatic cancer. You can do a Lynch syndrome marker. Like all of these have specific DNA spots they're associated with, and those you can test for.
Thank you.
Any other questions? So I'm going to say thank you for joining. What I will do is I will put my email address if you guys would like. Can you all see the chat? I'm not sure. And if you have any follow-up questions or need to get set up with a medical professional, there's my email. Just go ahead and reach out to me, guys. And I am more than happy to answer your individual questions about this or any other topic, and get you to see anybody you need to see. So please don't hesitate to reach out.
Dr. Pratt, can you,
Yes.
for the members who are in service in church at the present moment, can you repeat your email address for them?
Sure. You know what? It's a really long one. Is this you, Christine?
I can give it to them.
Do you mind?
Yes.
And if you like, just go ahead and reach out anytime, guys. Like most people, I'm constantly on my email, so please reach out. You're not bothering me in any way, shape, or form. And if I don't have the answer, I'll make sure that we get you to somebody who can get you the answer.
Dr. Pratt, can I have your job telephone number?
Sure. You know what? It's a little rough. It's a 718-250 8910. This is my coordinator. Her name's AJ. She may sound a little confused while you're calling, so don't worry. Just say, hey, I'd like Dr. Pratt to give me a call back. Here's my number.
Can you repeat the last four for me, please?
Yeah, it's 8910.
8910. Okay, this is just in case anyone wants to make an appointment to see you.
Absolutely.
Thank you.
All right, guys, have a beautiful Sunday. It looks like it's starting to get sunny. So hopefully we can all get out there, do a little gardening, since it's
thank you
warmer.
so much for coming on, and thank you for spending the time with us. I want you to enjoy the rest of your day. And from Bedford Central Presbyterian Church and our pastor, thank you.
Oh my God, thank you guys for having me. And let me know what I can do in the future. And if you guys need anything, please reach out.
Oh no, you will be back.
I hope so. I was going to say, we should really do colon cancer. Because I think that's something we can really move the dial on and get
you
in
will
the
be back,
community
but this
healthier.
time they want you to be in person.
Fair enough. I will do
But they
that.
want you to be back in person.
And if I also do minimally, there's lots of stuff we can do. And there's other people in our department so we can absolutely do this, guys. Bye.
Dr. Pratt, bye. Thank you.